Sunspots or solar lentigines are small dark patches that appear on areas of the skin most exposed to the sun, particularly the face. They can also appear on the back of the hands, forearms, and upper chest. Let's go over 5 effective steps to remove sunspots from your face. But before we begin, do me a quick favor and hit the like button down below and subscribe if you found value in this video. We talk about all things skin, hair, and health, and if that's something you're into, consider subscribing to stay up to date with new weekly videos. Sunspots are caused by prolonged exposure to the sun's ultraviolet rays, which trigger an overproduction of melanin, the pigment that gives your skin its color. Over time, these clusters of melanin become visible as sunspots, typically on the face, hands, and shoulders. I've seen them on the back as well. Interestingly, depending on which country you're from, they occur on the side of your hand, arm, or face that faces the window when you're driving your car. And this is because side windows are usually made of tempered glass, which doesn't block UVA rays, as well as laminated glass. In fact, only about a third of UVA radiation is blocked by clear side windows. So if you spend a lot of time driving, it's something to keep note of. And while these dark spots are usually harmless, they can be aesthetically bothersome for some people, and most of the time they start to creep up in your late 30s and 40s because the skin is less able to regenerate from sun exposure. Sometimes you hear them being called liver spots, but the spots derive their name from the fact that they were once incorrectly believed to be caused by liver problems, but they're physiologically unrelated to the liver. An important thing to also note before we begin is that sometimes they can also look like melanoma. So it's important to have a dermatologist rule it out first and ensure that it's actually a sunspot. Now, with that out of the way, let's get into step 1. The first and most effective step in reducing sunspots is regular exfoliation. Exfoliation helps remove the outer layer of the cells where sunspots tend to settle. 2 powerful exfoliating agents you should look out for are alpha hydroxy acids and beta hydroxy acids. Studies show us that both AHAs and BHAs increase skin cell turnover, which helps to fade hyperpigmentation like sunspots over time. And when you start, you want to make sure you don't go overboard with it. So using an AHA or BHA exfoliant 2 to 3 times a week on the area should be good. But if you want a more gentle option, you can try out an LHA, a lipohydroxy acid like the La Roche-Posay Pigment Clar Brightening Exfoliating Face Wash. It's formulated with a non-particle, non-bead lipohydroxy acid to help shed dark cells from skin's surface and clear away dullness. One of the key factors to younger looking skin is actually having an even tone, and an LHA can be a great place to start, especially if your skin is more sensitive to AHAs and BHAs. And if that's the case, an LHA is a better fit for you then. Step 2 is to use a vitamin C serum on the area. One of the best ingredients for brightening the skin and reducing pigmentation, including sunspots, is the use of vitamin C. This is because it's a powerful antioxidant that neutralizes free radicals and helps with melanin inhibition. And it does so by blocking the enzyme tyrosinase, which is responsible for the production of melanin in the skin. Over time, this lightens sunspots and evens out skin tone once a few skin cycles have turned. And for this, you want to apply the vitamin C serum daily, ideally in the morning before sunscreen. The COSRX Pure Vitamin C 23% serum with vitamin E is a good option. It's definitely a heavier serum, but soaks into the skin nicely. Just remember to store it in the refrigerator to help the vitamin C stay stable. Step 3 is to incorporate a retinoid. An over-the-counter retinoid that I've talked about in the past that works great for this is adapalene. Retinoids are essentially your vitamin A derivatives that are well known for their ability to boost skin cell turnover, which is key for fading sunspots. They accelerate the process of shedding old damaged skin cells and replacing them with new healthy ones. Just make sure to use the adapalene at night and vitamin C in the morning. Oftentimes what happens is the retinization process with adapalene, it causes your skin to break out before it clears up. I highly recommend you watch this video to learn more about how to mitigate it in this video here. Step 4 is using an at-home microneedling device that can also deliver dark spot serum. The Cure microinfusion system pushes the active ingredients deep into the skin via microchannels created through the microneedles. It's a lot safer than at-home derma rolling and virtually painless too. The pain is like a 1 out of 10. But make sure that you go with their rejuvenating serum, as it contains epidermal growth factor, niacinamide, and tranexamic acid to fade the sunspots away. If you want an in-depth step-by-step on how to use it, then watch this video here. But essentially, it's just once every 2 weeks. The week that you use it, you can go ahead and skip your exfoliants and retinoids for that week, just to make sure that your skin doesn't become too irritated. Sometimes this step alone, guys, can do the trick, but it should always be paired with step 5, which is sun protection. Multiple studies show that using sunscreen with an SPF of at least 30 significantly reduces the risk of sunspot formation. Make sure it's a broad spectrum sunscreen which protects against UVA and UVB rays. And reapply it every 2 hours if you're spending time outdoors, and pair with other forms of protection like hats and sunglasses, some even like those sleeves and gloves, especially if you spend most of your day between 10 a.m. and 4 p.m., which is when the sun's rays are the strongest. It's also when the sun itself is the highest in the sky. Your chances of sunspots goes up during this time window. But I'm more curious to hear from you guys now. What has helped you with your sunspots? Comment down below. Also subscribe if you found this video useful, and I'll see you on the next one.